So if you've come in the last year or so and we've worked on anything from a lower back to an extremity, your knee or shoulder, I may have done a technique on you where I'm working pretty deep into your tissue, and you may have pointed to a spot that was hurting, and some people probably think, well, he's just pushing really hard on the point of pain, or he's just gliding across a really painful area. What we're doing is we're working in the body what's called the fascia. Now, the fascia is like if you ever skinned a deer, or you're cleaning a chicken or whatever, it's the white covering that's over the muscle. And used to, they would think the fascia, years ago, the fascia was just some kind of sac that held the muscle. But the fascia actually transfers force in the body. So it's like the cables that pulls force. The fascia can have problems. It can wrinkle, it can tear, it can fold, it can get where it's just not functioning properly. And so when you come in the clinic and you have an issue with an extremity, a lot of times you're going to get some pretty deep work done, and it's going to be fairly painful. In fact, sometimes there's bruising. But this type of work that we've been doing in the last year or so has been some of the most productive work that I've ever done since I've been in practice, as far as dealing with pain, dealing with range of motion, dealing with just getting people doing better for difficult things like their knee or their shoulder. And so I'm going to just kind of demonstrate on you what it would look like if you come in, if you have an elbow problem, a knee problem, a shoulder problem, a foot problem, a lot of plantar fasciitis we do this on. I'm going to show just quickly what it might look like. It is a painful technique, but the results are very quick with this technique. And also, usually when the person stands up from after they've been treated, they know immediately that they're doing better. Or their shoulder, for instance, they will know immediately that their shoulder range of motion is better just from the 3 or 4 minute treatment that we do on them. And I've honestly never seen anything like it before in my career since I've started doing this. This technique was developed by an osteopath about 20 years ago, and it's come to the forefront recently. I've trained most of my massage therapists on how to do a lot of this technique, and so I'm just going to demonstrate right now. So let's say Charlie's having an elbow problem right here. Of course, I would talk to the patient. He might tell me, just point to your elbow as if it hurts, Charlie.
Sometimes it hurts right.
So he might point like that. There's ways we interpret from how the patient tells us and shows us that the fascia has an issue. And so you might see me come in and do something like this when you come in for an elbow issue. After I kind of feel around and find the exact point, I might come in and I'll ask, where's the worst point? And I'll get really hard right there on the bone a lot of times to push the fascia back against the bone. And I'll get in really hard and push like that. It doesn't last very long though. It's usually just a couple of seconds that we hold these pressure points. But you do kind of have to sweat it out. It kind of gets people's blood pressure up when we do this. So, but anyway, this is some of the type of techniques that we use here. And we'll find what's called herniated trigger points in the muscle. Like as I passed over there, there's a little spot right there, and I'll get in and work on that. So whatever the area of the body is, we pretty much have a technique that we can treat it. And a lot of times people avoid shoulder surgery. I've seen a lot of that. They avoid knee injections or knee surgery because we're able to work with the fascia and get their body functioning like it should.